Hi Carly, what brings you here today?
Hello, I am hoping to get a breast augmentation.
Something you've been thinking about for a while?
Yes, a very long time.
Okay.
I was hoping that part of my body would grow with my height, but it didn't. So,
Just a few basic questions. Have you ever had any children?
No.
Any plans on having any kids in the near future?
No.
Okay. And have you ever gained or lost a lot of weight?
No, I fluctuate a few pounds here and there, but nothing huge.
All right. And do you know what your current bra size is?
Like a 32B,
All right. And,
small.
And what's your goal?
Like a very full B, small C.
Okay. All right. Generally, we have a chart that shows you different profiles of breasts, and there's no right or no wrong answer. But Meshon's going to show it to you, and you can just pick one that you think you prefer.
4.
Okay. All right.
A natural 4.
Okay. All right. So what I'm going to do next is I'm going to step out for a minute, and I'm going to have you change. We're going to come back. We're going to take some measurements, and then we have some breast implant sizers, and those sizers are, I call it the Goldilocks method. Basically, we're going to go too small, too big, and then hopefully just right. And then based on your measurements, your desire as far as the shape that you want, and the sizes, we come up with an implant size. We'll talk about where we want to put it in your breast and all those kinds of things. Okay?
Cool.
All right, so I'll step out and let you get changed. Okay?
Cool.
Okay, I'm going to take 6 measurements on you, okay?
Okay.
You just leave your hands by your side.
Okay.
$19.5. $19.5. $5.5. 5.5. So you're very symmetrical,
Yay!
which is
normal?
not always that common, honestly.
Oh,
Now this is the
cool.
most important measurement. This measures your base width of your breast, and this gives us a footprint of the implant that we can put in you.
Okay.
11 centimeters. 11 centimeters. Very good.
Cool.
Okay.
Okay.
When I asked Dr. Miles what my new size would be, he explained to me that this is often one of the most difficult decisions and for many reasons can have the most potential for disappointment. During the consultation, we tried on different sizes and tried to identify what size of breast I desired for my augmentation. As a general rule, every 125 to 150 cc's of implant volume equals an increase in a single cup size. However, every patient's body is different. Dr. Miles explained to me that it's recommended that patients begin walking immediately after surgery. However, women should not perform any intense physical exercise for 6 weeks following the operation. Physical exercise including weightlifting, biking, jogging, and other forms of intense activities may cause implants to shift position or cause wound healing problems that may alter the appearance of the breasts after surgery. Dr. Miles explained to me that the pain from breast augmentation surgery is usually moderate in range and generally can be well controlled with medication in the first 1 to 2 weeks following the surgery. It's important to note that severe or untreatable pain following surgery can mean infection or another complication. Another frequently asked question that Dr. Miles explained to me was the question of breastfeeding after augmentation. The simple answer is yes. Placement of the implant below the breast tissue, as in subglandular placement, does not affect the ability of the breast to produce milk. Similarly, submuscular placement or implant placement below one of the chest muscles preserves proper breast functioning. This depends on your job and its physical demands. However, some general guidelines are: upper arm movements, like reaching, should be avoided for the first 1 to 2 weeks. Lifting anything heavier than 5 pounds should be avoided for 6 weeks after the surgery. This lifting restriction may prevent some women from returning to work. The simple answer to this is no. Dr. Miles explained to me that many studies have shown that women who get implants are not at an increased risk for getting breast cancer. In addition, implants do not delay the detection of breast cancer. Numerous studies, as well as evidence from the National Cancer Institute, show that having implants does not hinder the patient or their physician in finding breast tumors. Finally, the breast implant patients who do get breast cancer have the same chance of obtaining remission or being free of cancer for 5 years as women without implants.